this video, we will see the different aspects of online consultations and best practices to keep in mind to deliver a high-quality patient experience. Observe how the doctor is ready for the consultation, ensuring privacy for the patient. The doctor is calm and seated and goes through the case history received on the doctor app before actually starting the call. Always check for gender and age, and if you notice any discrepancy, reconfirm with the patient.
Hi, this is Dr. Seema. I'm calling from MediBuddy. Am I speaking with Apurva?
Hi, doctor. Yes, I'm Apurva.
The doctor introduces herself and addresses the patient by her name. Notice the pleasant smile and the tone of voice, which is the first step to rapport building.
Hey, hi Apurva, you had started a consultation, right, on the app. Was it for yourself?
Yes, doctor, it's for me.
Okay, and you mentioned some health issues like fever. So could you tell me more about it?
The doctor confirms who the consultation was for. This is important as many times consultations are taken by proxy. The doctor then restates the patient's issue as given in the history on the app. This not only helps in focusing on the issue at hand, but also lets the patient know that we are active listeners. Using an open-ended statement like "tell me more" gives the patient an opportunity to tell her story.
So, doctor, I went to Delhi 3 days back for work,
Mm-hmm.
and when I came back, I was really tired. I took a day off as well.
Mm-hmm.
But then I started getting fever,
Mm-hmm.
and it was like the pattern was like it will come in the morning and then go away in the evening, and at night again I'll get the fever.
Mm-hmm. Mm-hmm. Okay.
So that's the pattern.
Note how the doctor is using non-verbal cues such as and head nods. These help the patient to know that she is being listened to, which strengthens the doctor-patient relationship.
Okay. So how many days since you've had fever?
It's been 3 days, and I've been taking normal fever medicine,
Mm-hmm. Okay. And what is this medicine?
paracetamol.
Okay. And since you mentioned that the fever is how high, did you check it on thermometer?
Yes, doctor. So the fever went up to like 101,
Mm-hmm.
and last night it was 100.
Mm-hmm. Mm-hmm. Okay.
So that's the pattern. It didn't cross 101, but shuffling between 100 and 101.
Okay.
The doctor uses close-ended questions to understand more about the problem at hand and then asks contextual questions based on the responses.
So what I understand is your fever has been twice a day for the last 3 days, right? Any other symptom along with that?
No, doctor.
Okay. So any runny nose that you've noticed or any cough, anything like that?
So running nose was not there initially.
Mm-hmm.
Morning, it's not stuffy but watery.
Okay, I understand. And anything else like you're feeling chills when you have fever, stomach pain, urine problem, any rash on your body, or any body aches and pains, headache, anything at all?
No, doctor, no.
Nothing. All right.
The doctor summarizes the presenting symptom and further probes into related symptoms.
Do you take any regular medicines, Apurva, for anything else?
Nothing specific. I just take multivitamins on a daily basis.
Okay. And do you by any chance know the name?
No, I'm not sure actually.
Okay, you could send me the name maybe on a chat message or the picture of the medicine that you take. Okay?
The doctor asks about current medications to get her medical history. In older patients, it would be necessary to specifically ask about chronic diseases like diabetes and hypertension.
I'll do that.
Right. Any medicine allergy, right? Any medicine causing you, loose motions or any rash on your body that has happened?
The doctor now takes the allergy history. Note how she used symptoms to explain the allergy, as some individuals may not understand it easily.
Nothing.
No.
All right. So Apurva, what I understand is that you've been having fever for the last 3 days. You get the fever at least twice a day and you've taken a fever medicine, but it doesn't seem to be getting better. You also mentioned a runny nose that you've started, but no other symptom apart from that. And you also said that you don't have any allergies and you take only a multivitamin, no other medicines other than that, right?
Yes, doctor.
Okay.
The doctor summarizes the consultation to ensure that everything has been noted, and also to clarify if there are any other missed details.
A little personal question: how your periods are all right? You're normal? You get your cycles okay?
Yeah, it's okay.
Wonderful.
Taking permission to ask personal questions about menstrual periods, habits, etc. shows respect towards the patient's comfort.
So how are you taking care of yourself? Like, do you have anybody at home?
Yeah, I live with my parents.
Okay,
and
good.
I'm concerned about them only because they're old age and I've been it is going on around. So thought of consulting a doctor so that I should be careful.
The doctor quickly touches upon the social aspect to understand the patient's background. This can help us give them a holistic management plan.
Okay. And what do you think is happening with you? What could this be?
As I mentioned that I am scared about COVID, so I thought that might be it's COVID because it's not going away. Only 3 days the fever will go, but it's.
I can imagine.
I will talk to a doctor.
All right.
The doctor empathetically explores the ideas and concerns of the patient.
Well, good that you reached out, and I understand your concerns as well. See, on one hand, we have to take care of your symptoms, right? So for your fever, you need to take a fever medicine, something like paracetamol, 650 milligrams. Ideally, you need to check your temperature every 6 hourly, and if you do have a fever, then you should take it. Maybe your need for fever medicine is a little more than what you're taking. Apart from that, you should definitely take a medicine like an anti-allergen, something like levocetirizine, say a 5 milligram tablet at night, which will help you in reducing your runny nose. It's important that you drink a lot of water, you do steam inhalation, eat light and simple home cooked food so that you can recover faster. Okay?
Okay, doctor.
All right. Now, besides that, I understand your concern about COVID. And because your fevers have been around for more than 3 days now, it's a good idea that we check basic bloods, right? To check what it could be. Fever can be because of many reasons. Common cold, flus, dengue, COVID, anything can be a possibility. So basic blood work, say doing a complete blood count, a CRP, and basic, maybe a COVID test. You could do even a home antigen test as well. Do it and let me know the results. I will write these tests on your prescription. Okay?
The doctor explains the management plan at length, explaining the symptomatic treatment, non-pharmacological advice, lab tests, and precautionary measures.
In the meantime, I'm hoping that you've already taken care of precautions in terms of, staying a little away from your parents. I hear that they're old age, right? So maybe isolating yourself a little bit because of this worry of COVID that you're saying.
Okay, doctor.
Right?
Yeah, I'll do the test.
Great. So I will write these 2 medicines. One is paracetamol, levocetirizine on the prescription as medication. I will write 3 tests for you, which will help us to know basics of what could be possibility of the infection that you're having. And I will also write a couple of advice like drinking lots of water, steam inhalation, taking care of yourself, resting it out so that you recover faster. Once you have the reports in the next day or 2, please follow up with me so that we can take further course of action.
The doctor continues to summarize the treatment and gives a follow-up plan.
In the meantime, if you see any new symptom, say a cough, breathlessness, tightness in the chest, any new symptom like a rash or stomach pain, I want you to either seek help at a hospital or get back to me urgently so that I can help you. Okay?
Sure, doctor.
All right.
The doctor raises necessary red flags. This helps the patient to be aware and take action in case of worsening symptoms.
Then you take care of yourself. Apurva, I'll send you the prescription immediately after this call. Do read through it. If you have any doubts, you can always get back to me. I'm here for you.
Reassuring the patient and keeping the channels of communication open helps raise the patient's trust.
Okay. Thank you so much, doctor.
You too. Take care and good day. Bye.
Bye.
Appropriately closing the call is vital. For example, hope you feel better soon, or reach out to me if you have any other issues. This can be reassuring when conducting consultations online.